Hi, my name's Marila. I'm doing the eye assessment for Nursing 650, and this is Kyle, who I'm going to be doing the assessment on. Kyle, do I have your permission to record the assessment?
Yes, you do.
Okay. So first things first, when I enter the room, I'm going to wash my hands and I'm going to introduce myself to the patient. So my name's Marila. I'm going to be your nurse practitioner. Do you mind if I just do an assessment of your eyes?
That's fine.
Okay. Do you wear glasses?
No.
Contacts?
No.
Okay. Any eye infections? Any decline in vision?
No.
No, nothing?
Mm-mm.
Okay. So I'm first going to kind of inspect it. I'm just going to inspect his eyes and look, and I'm looking at his eyelids. I'm looking at his eyelashes, the alignment of his eyebrows. I'm looking for any drooping on either side, and for symmetry, any discoloration, any swelling at all. And these look good. I'm also looking at the palpebral fissure, which is right between the eyelids, and that looks good. I'm now going to look and inspect his sclera, which should be white. It may be buff colored towards the edges, but that shouldn't be mistaken with being yellow, which could indicate jaundice. So I'm just looking at the sclera, and that looks nice and white. I'm also looking at the conjunctiva, which is also over top of the sclera, and I'm just pulling down, and what I should see is pink and moist. Okay. And I'm looking at his iris, and the iris should be partially covered by the eyelid, but the eyelid should not be covering the actual pupil. Okay. So I'm then going to palpate the lacrimal apparatus. Okay. Good. So I'm going to test Kyle's visual fields by reading the Snellen eye chart. So I'm going to ask Kyle to cover one eye at a time and read the smallest font possible he can. So Kyle, can you cover your left eye first?
Mm-hmm. EFPTOZLPED
Perfect. So I'm going to get you to do the same thing with the other eye.
EFPTOZLEPDEFCT.
And would you say that both eyes are equal?
Yeah.
Okay.
Okay.
So that would mean that Kyle does have 20/20 vision and 20/20 in both eyes. So I'm now just going to do the pupil reaction test. So I'm going to test direct reaction, consensual reaction, and accommodation. So Kyle, look straight ahead, okay?
Mm-hmm.
And the pupil should constrict. A normal pupil is about 3 to 5 millimeters, which is also on the pen light, and his constrict to about 1 millimeter. So when I do it in the eye that the light's in, that constricts, and that's called direct direct reaction. When I'm doing it on this eye and the other eye constricts, that's called consensual reaction. Okay. So do you mind if I do it in the other eye?
Mm-hmm.
Okay. So I'm now going to do accommodation. So I'm just going to ask Kyle to follow the pen light when I move it towards his face. Just because when you're following something that's far and coming close to you, generally pupils will constrict as well. So go ahead and follow the pen light. Okay, perfect. Okay, so I'm also going to test the cardinal fields of gaze. So I'm going to ask Kyle to follow my pen light as I move through the 6 cardinal fields, okay? Both eyes did the same thing. So I'm now going to test his confrontation. So that looks for any lesions that are possibly there. So I'm going to ask Kyle to look right at me, and I'm going to see when he sees my fingers in the periphery. Okay? So the next thing I'm going to do is I'm going to actually use an ophthalmoscope and look at Kyle's eye. So to do this, I need to darken the room. So I'm going to go do that. to look into his eye, and I'm going to wait. And I don't actually have one, but I've used one before, and I know how to use one. I just don't have one at my house. But I'm just going to use it, and I'm going to wait his eye through the big light circle. And this allows me to see the pupil and other structures in the eye that I wouldn't be previously able to see. So that concludes the eye assessment. Kyle, do you have any questions?
Nope.
Okay. All right. Thank you very much.